Say hello, everybody. Hey all, so as you notice, we have a super special co-host. Sorry for the little bit of a delay at the very beginning. I was having a bit of a hard time getting it to respond to me putting up the intro. So, welcome to our second stream on Project 2025. There's a issue that somebody raised that I actually want to cover because normally I don't respond to these kinds of comments, but So Republicans are bad, first off, but second, we're not exactly over here simping for the Democrats. It's more like Republicans are bad and Democrats are less bad. So
yeah, pretty much. Yeah, so that's
Ikeda with a $20 super chat says Republicans give new meaning to better dead than red. That's funny.
Also, I do want to point out something very important as an Australian. The way Aliakai spelt Labour on the thumbnail hurts me badly because in Australia, we spell Labour as in like doing work, Labour, Labour, because we are the British. Basically. And in America, you guys, for some strange reason, drop the U. But in Australia, there is a party called the Labor Party, spelt Labor. So that thumbnail makes zero sense to me, and it hurts.
Whereas, unfortunately, the YouTube metrics state that the majority of people that are looking up labor are spelling it with OR, so it's staying that way.
But it's like, Republicans are trying to take away your libertarian rights. Republicans are trying to take away your Democrats' rights.
All right, so we have a couple of things that we need to mention. We are going to be opening up the stream by finishing parts of the National Institute of Health chapter. And just like last time, we will be reading directly from it. However, the link to the document that we are reading from is in the description. I'm not going to be putting it up on screen because we're concerned about copyright stuff. Because this is a published document and sometimes they get picky about that sort of thing. Number two.
Sorry.
Number two, Marrow is dealing with all kinds of background noise, so she'll mute her mic intermittently. But number two, even though trans issues are a part of healthcare and so are abortion issues, we are going to be reserving those for a future stream. Not because we don't care about them, but because there are other bigger named topics, namely surrounding labor and vaccinations and other things that we want to specifically cover this time around. And also because both of us feel that the media is doing a much better job of covering those aspects of things within this policy. Whereas some of the stuff that we want to talk about is not really being discussed in most of the articles that we're seeing on Project 2025. And I personally, as a creator, have noticed as we're going through and revisiting lots of these chapters in preparation for the stream that they use a lot of anti-woke language and a lot of very anger-inducing language in the hopes that they'll shut your brain off as a progressive, so you get mad and don't notice the heinous policy things that they want to do in order to get the power to do those horrible things that they say. And they'll do this often right before, strategically, they want to do something that absolutely should be shouted from the rooftops. So, even though we might be reading some very anger-inducing language, chat, please, alongside us, try to focus on the policies themselves that they want to put forward and the way they want to get there, because that's the pertinent information for us to be able to fight them. We already know that they hate trans people. We already know they want to get rid of abortion. We already know that they want to criminalize things like miscarriage. We already know a lot of these things. We already know that they don't like diversity, equity, and inclusion. We already know that they don't think racism is real. Like, these are things we already know. However, what we don't know until we dig deeper is the path to power that they're implementing. And that's really what we both want to focus on for this stream. Because we can do something about that potentially.
Also, the next door neighbors decided to start making very loud noises. So if I'm quiet for quite a lot of the stream, it's because there's that noise in the background. So I apologize. Can you hear that noise, Ali? That me.
Not right now.
Okay, awesome.
All right, so with that in mind, Marrow is actually going to be taking the lead on the first part of the healthcare section because we left off without hitting goal number 5.
Which is page, where is it?
That's page 452, or on the PDF it'll say 484.
Yeah, 484 on the PDF. So everyone, pull out your textbooks, turn to page 484, and start screaming into the void. Okay.
So we have goal number 5 to go over, and then we have the stuff on the CDC because we just started to dip our toes into the COVID-19 stuff last stream, and I kind of want to wrap that up because Marrow has an entire rant on that. And again, we promise we are going to get to the Department of Labor stuff, but we do want to finish up our section on healthcare because there's some scary things they want to do to Medicare and Medicaid that we also need to cover.
Yeah. Did you want me to read?
Go ahead. So read goal 5, and then we'll talk about it, and then we'll get to their stuff on the CDC and VAERS.
Yeah. And so goal number 5, instituting greater transparency, accountability, and oversight. Oh, that sounds good. Let's hear what they want to say. The next administration should guard against the regulatory capture of our public health agencies by pharmaceutical companies, insurers, hospital conglomerates, and related economic interests that these agencies are meant to regulate. We must erect robust firewalls to mitigate these obvious financial conflicts of interest. All National Institutes of Health, Centers for Disease Control and Prevention, and Food and Drug Administration regulators should be entirely free from private biopharmaceutical funding. In this realm, public-private partnerships is a euphemism for agency capture, a thin veneer for corporatism. Funding for agencies and individual government research must come directly from the government with robust congressional oversight. We must shut and lock the door, the revolving door between government and big pharma. Regulators should have a long cooling off period on their contracts. 15 years would not be too long. That prevents them from working for companies they have regulated. Similarly, pharmaceutical companies' executives should be restricted from moving from industry into positions within regulatory agencies.
So finally, I would like to pause here for like 2 seconds. All of this sounds like things that most of us would agree with, right? Like, hey, we need to shut down the revolving door with these agencies. We need to like cut off some of the public-private partnerships, like, the rapid approval of drugs and things of that nature. All this sounds great until you get to the last paragraph.
Finally, HHS should adopt metrics across the agencies that can objectively determine the extent to which the agency's policies and programs achieve desired health and welfare outcomes, not agency outputs, which is what is not measured is not achieved. So that's a lot of
notice how they buried that in the very last paragraph. Can I get a show of hands in the chat? How many of you grew up during the No Child Left Behind Act?
I mean, I'm assuming some of you did. I didn't.
I did. No Child Left Behind actually did this with education. And what it resulted in was a whole bunch of kids left behind and the complete like breakdown of the education system in a whole bunch of states.
So can you explain this to me? Because that's a lot of legalese.
So basically what they're saying is that they want to take people's private health data, turn it into a whole bunch of statistics, and then use that to dictate how much funding goes into programs like Medicare and Medicaid. So if you get a whole bunch of seniors who, say, develop diabetes, well, that's not positive health outcomes. Ergo, we should slash funding.
Right. Right. Anyway.
We can all surmise why this is a bad thing, right? I don't have to spell this more out for you. Because if you're talking about health outcomes, you're not talking typically about deaths. What you're talking about is diagnoses. most of the
Yeah.
time. So people get heart attacks, people get strokes. Oh no, like the Medicare and Medicaid clearly isn't doing what it's supposed to, even though the whole point is that you're supposed to have a safety net if you have a heart attack or a stroke or diabetes or whatever.
Yeah. So it's that attitude of, oh, you could just exercise and eat well away, I don't know, a broken arm. If you
Oh,
were eating well and not and exercising more, you wouldn't have a broken arm. Yeah, but I'm an athlete. So
we have a $5 super chat from Makeda Hakubi. Wasn't the GOP opposed to death panels? Supposedly, yeah.
yeah, they
Except
were.
when COVID-19 is concerned, which is the next section that we want to talk about. They want to completely screw over the CDC. Let's get into it.
Oh yeah. Okay.
Same page for those following along.
It's at the bottom of 452 on the thingamajiggy, or 484 if you go on the PDF. Centers for Disease Control and Prevention, CDC. COVID and structural reform. COVID-19 exposed the Centers for Disease Control and Prevention as perhaps the most incompetent and arrogant agency in the federal government. Just kind of reminding you that Donald Trump disbanded the pandemic prevention team in 2019.
Let's go ahead and finish the paragraph before we start ranting.
Okay.
Marrow,
All right.
restrain yourself. We've got this. Like they are. Remember what I said about triggering language at the beginning? We need to set the example.
Yes. CDC continuously misjudged COVID-19 from its lethality, transmissibility, and origins to treatment. We were told masks were not needed, then they were made mandatory. CDC botched the development of COVID tests when they were needed most. When it was too late, we were told to put our lives on hold for 2 weeks to flatten the curve, and that turned into 2 years of interference and restrictions on the smallest details of our lives. Congress should ensure that CDC's legal authorities are clearly defined and limited to prevent an recurrence of any such arbitrary and vacillating exercise of power. The CDC should be split into 2 separate entities housing its 2 distinct functions. On the one hand, the CDC is now responsible for collecting, synthesizing, and publishing epidemiological data from the individual states, a scientific data gathering function. This information is crucial for medical and public health researchers around the country. On the other hand, the CDC is also responsible for making public health recommendations and policies, an inescapably political function. At times, these 2 functions are in tension or in clear conflict. In February 2022, for example, it was reported that 2 full years into the pandemic, the agency leading the country's response to the public health emergency has published only a tiny fraction of the data it has collected, much of which could have helped state and local health officials better target their efforts to bring the virus under control. A CDC spokesman said that one of the reasons was fear that the information might be misinterpreted.
So I'm going to pause you for a second. So keep in mind, when they're talking about splitting this agency up, remember that in the first stream, which if you haven't seen that, make sure you catch that after we're done with this one. Remember, one of their stated goals was to decrease the number of protected career officials in every government agency and increase the number of political appointees. I wonder what the motivation behind wanting to split the CDC into 2 might be.
I don't know. These distinct functions would be separated into 2 entirely separate agencies with a firewall between them. We need a national epidemiological agency responsible only for publishing data and required by law to publish all of the data gathered from states and other sources. A separate agency should be responsible for public health with a severely confined ability to make policy recommendations. Ooh. The CDC can and should make assessments as to the health costs and benefits of health interventions, but it has limited to no capacity to measure the social costs or benefits they may entail. For example, how much risk mitigation is worth the price of shutting down churches on the holiest day of the Christian calendar and far beyond as happened in 2020?
Deep breath, Marrow. I know trigger phrases. Just keep going. Those things are put in there to make you get mad and shut your brain down. We got to keep going.
Yep, got to keep going. What is the proper balance of lives saved versus souls saved? The CDC has no business making such inherently political and often unconstitutional assessments and should be required by law to stay in its lane.
So I'm going to make another comment here. If we were to split the CDC into two different bodies, one of which, again, I'd assume they'd fill with political appointees because that's the goal of this project, is to give the president even more power. Anybody here who has ever had a government job or known anybody who had a government job knows how difficult interagency communication is. You'd basically be creating an entire rogue agency who had absolutely no requirement by law to implement policies based off of the data collected by the other one. Just saying.
Yeah, and also one of the things, one of the problems with publishing all data is that if you publish raw data, you can't, you're not getting rid of the
HIPAA
noise.
violations.
Yep, HIPAA violations is another one. But even still, like, you can have a look at raw data, and you're not, and if you haven't, it's like, are we going? I think they talk about VAERS later, and we can talk about that. But anyone who's done a statistics course knows you don't rely on raw data. You need to process the data to get rid of all of like outliers, get rid of p-hacking, those sorts of things like that. So
I'd like to highlight Miath's Reading Corners comment here because I think that they've really hit the nail on the head. Keep the organs of government non-functional so the real power remains in the dictator's hands.
Yeah, that's pretty much it.
Okay, but keep going because it actually does, in fact, get worse. And yes, y'all can meme on that all you want. Just make sure that if you are taking shots, that at least half of them are water.
At least. And make sure you take some vitamin B as well.
Also, if you guys have questions, feel free to pop your questions in the chat. Just make sure that they are applicable directly to the policies and such that we are attempting to focus on.
Okay. Yeah. So the CDC's initial COVID-19 testing failures were largely a result of agencies prioritizing its own development and production of tests using its internal staffs and facilities. The private sector is much better positioned to tackle the private sector is much better positioned to tackle the challenges inherent in developing and manufacturing novel products, as illustrated by the relative success of the alternative approach to facilitating the development of COVID-19 vaccines and therapeutics by private companies that was adopted by the Food and Drug Administration.
Didn't we just have a conversation about how private agencies are too involved in the FDA? Remember when I said that fascism generally and fascists have no allegiance to any ideology that isn't continuing to maintain their power? This is a perfect example of that.
I will continue. When it comes to testing, the CDC's role should similarly be to facilitate rather than supplant the efforts of private test developments, academic laboratories, state public health laboratories, and clinical testing providers. When responding to a novel pathogen, the CDC should focus on gathering and disseminating information, including specimens needed for the development of positive controls and reference panels, and ensuring that test developers can develop and validate diagnostic tests. These changes will require a shift in priorities and culture at the CDC and throughout HHS more broadly.
But weren't they also just saying that, like, private-public partnerships need to be reduced?
Yeah. And also, like, the Pfizer vaccine was it Pfizer or Johnson & Johnson?
Moderna was 50-50 with the government. Pfizer and Johnson & Johnson were both independently developed. Okay.
Yeah, because there was the Oxford AstraZeneca. That's it. AstraZeneca, basically, Oxford University made the AstraZeneca vaccine, and then AstraZeneca came along and just went yoink. That's mine. So,
oh, keep going. It gets worse.
Okay. Most problematically, the CDC presented itself as a kind of super doctor for the entire nation.
Nope. Again, that's literally put there to make you mad.
The The CDC is a public health institution, not a medical institution. According to its mission statement, the agency focuses on disease prevention and control, environmental health and health promotion, and health education activities. It is not qualified to offer, and usually does not purport to offer, professional medical opinions applicable to specific patients.
Okay, but it does offer recommendations on a federal level, which you guys were just saying it shouldn't do.
From time to time, the CDC offers findings and recommendations that competent medical practitioners often will consider in arriving at a professional medical judgment for a particular patient. In this respect, CDC guidelines are analogous to guidelines from other public health associations or medical societies. They are informative, not prescriptive. Isn't that what they've always done?
Keep going.
By statute or regulation, CDC guidance must be prohibited from taking on a prescriptive character. For example, never again should CDC officials be allowed to say in their official capacity that school children should be masked or vaccinated through a schedule or otherwise, or prohibited from learning in a school building. Such decisions should be left to parents who have no medical training, by the way, and medical providers. We have learned that when CDC says what people should do, it readily becomes a must, backed by a pop-up on my screen, backed by severe punishments, including criminal penalties.
Last sentence. You can make it.
CDC should report on the risk and effectiveness of all infectious disease mitigation measures dispassionately and leave the should and must policy to calls to politically accountable parties.
Yeah, the people that are afraid that they're going to not get voted in versus, trained medical professionals. All right, Marrow, we are in the first 20 minutes. We agreed we'd try to get to the labor section. So keep that in mind as we talk a little bit about the differences in the way that our countries responded to things and the differing health outcomes.
Yeah. Okay. Australia locked down, and we actually shortly became the leader in COVID infections and deaths in 2022. Why was that? Because we had a naive population, because the country shut down and we had no problems with COVID.
To start off with.
Yeah. And what we did is we shut down.
Closed borders too.
Closed borders. And as soon as Anastasia Palaszczuk, who was the state premier, she shut down as soon as we got 3 cases in that was in the community. She went, everyone shut down for 3 or 4 days. Everyone shut down for a couple of days. And the outbreak stopped. And then once enough people got the vaccine, they just went, open up. And we haven't had a shutdown since. And literally in 2022, we were the world leader in at the beginning of 2022. We were the world leaders in infections and deaths because we allowed it to go to rip. So that's what happened here. There was a lot of people we're still feeling the effects of the shutdowns, and that probably won't go away for the next couple of years. But as a general rule, we did really, really well. We did incredibly well, actually. So that's.
But also, think about a couple streams ago, the last stream we did about, smallpox. If the CDC cannot force a population to get vaccinated, and say the ice shelf melts and smallpox is reintroduced into a naive population where less than 50% of people are vaccinated against it, what do you think is going to happen with a 33% death rate?
At least. There's considering that there's a lot of naive people in the world right now, and if it's variola major that gets released into the population,
Or if it
um,
escapes from a lab again, because that's happened.
yeah, I don't think that's likely to happen. But then again, there is a war happening in Russia.
Yes,
Um,
there are multiple wars happening at the moment on the ground, so there is a chance that it could happen.
um, sorry, I've got a snake versus cat situation happening here. So, but if it's variola major that gets released into a completely naive population, um, it could happen what happened with the indigenous peoples of Australia, where 90% of the people who got smallpox died. So, if we
Yeah.
if the CDC says you're not allowed to vaccinate against smallpox,
Well,
I,
it wouldn't be again. It wouldn't be you're not allowed to. It's you're not. The CDC
no,
is not allowed to mandate the vaccine, even though it
yeah,
might be a necessity for saving your life.
yeah, and then
Uh,
of course by it not being made, hang on, sorry, the cat likes to try and attack the snakes. Obviously, I don't want that happening. And there's a cat right down here going, "Oh, there's a snake." Yeah. So if there's
that's Thyla. That's Thyla, Akeda.
this was Thyla, yes. Lilith
If it
is
were Lilith,
the
she'd
grey
be
one.
trying to eat Marrow.
Yeah. If it was Lilith, I'd have a hand. I'd have one hand covered in snake.
Or a knee.
Yeah, or a knee. Although she was pretty quick to figure that one out. Yes, my snake tried eating me via my thigh. My snake is that other snake is the same size as this one. Stupid. um. Anyway. Yeah. So
we have one more section for your area because we are up to the 27-minute mark, so we do need to kind of push forward a little bit. Data collection. You wanted to talk about VAERS.
is that the data systems, the COVID-19, or where is it?
No, that's the VAERS, the vaccine adverse effects reporting
Yeah. No.
system.
I'm looking at like where are you on the
454/486.
Okay.
There's a conflict of interest, which we covered earlier, but it to summarize the conflict of interest paragraph, basically the Republicans are mad that the researchers that contributed to developing the Moderna vaccine and the National Institute of Health get a 50-50 royalty split. Or rather, the National Institute of Health gets a royalty split, and a small amount goes to the researchers who actually develop the vaccine, like any other patent holder.
Yeah. Yeah.
So,
Apparently it's a bad idea to pay people for their work, which actually, ironically enough, is exactly what we're about to start talking about.
yep. I mean, they don't want anybody paid for anything.
Pretty much. Yeah. So yeah, so that's the conflicts of interest, It's not actually. Paying people for their work is not a conflict of interest. A conflict of interest would be like, I don't know, you're a think tank and you are supporting of the Republican parliament and then you try and teach Republican people, the Republican politicians, to enact policies that would make your think tank become more powerful. Yeah, and then you actively work to put those Republicans in power. That would be a conflict of interest. I don't know what I'm talking about. I can't think of any examples right now of what I'm talking about.
nope,
Can
not
you
at
think
all.
of what? No, I can't think of any strangely specific reasons why I would say that.
So coming back to, unfortunately, I wanted to cover VAERS. We're gonna have to do that on a future stream. We did
Yeah.
actually talk about it in a previous stream. We were talking about vaccine safety, so go catch that ancient stream where back in the olden days when I had a different co-host, but that person didn't show up, so it was just Marrow and I. So one of the very first Marrow co-hosted podcasts we had.
Yeah.
However, I would like to move down to 462/495. The Centers for Medicare and Medicaid Services.
This is more you, because I have no idea what you're talking about, because I have a functioning health system in my country.
All right, so I want to move down to 463. Start with the bolded increase Medicare's beneficiaries' control of their healthcare and continue through reduce regulatory burdens on doctors, because there's some interesting things in the way they phrase it. Sounds good until you actually think about the ramifications of what they're talking about.
I will do the entire bullet points, and I will. Okay, I'll speak a little bit louder when it comes to the bolded areas. Increase Medicare beneficiaries' control of their healthcare. Patients are best positioned to determine the value of healthcare services working with their healthcare providers. They also benefit from increased choice of doctors, hospitals, and insurance plans. Access to reliable information with respect to physicians, hospitals, and insurers is therefore essential. 2. Reduce regulatory burdens on doctors. Doctors must be free to focus on treating patients first, not entering codes on computers, and should not be tempted to change their medical judgment based on arbitrary or illogical reimbursements incentives. 3. Ensure sustainability and value for beneficiaries and taxpayers. Prices are best for patients when determined by economic value rather than political power, and when they are known in advance of the receipt of services. Governments.
It's another trigger phrase. That's another trigger phrase, but we can talk a little bit about the differences in our healthcare systems after this section.
Government's use of non-market-based methods to determine reimbursement leads to overspending on low-value services and products and underpayment for high-value services and products, stifles beneficial innovation, and because of Medicare's size, distorts payments throughout the healthcare system. Even I'm getting triggered here. Intermediate entities that can manage financial risk and ensure quality of care are important in transitioning to value-based care within Medicare programs. And 1, 2, 3, 4, 5, 1, whatever. Next dot. Reduce waste, fraud, and abuse, including through the use of artificial intelligence for the detection. Okay, I have finished the dot points.
So, what they're talking about here, which, at least one person mentioned disabilities in the chat. Currently, there are caps set on Medicare and Medicaid prices. Caps, by the way, mean a top threshold for how much the government will pay for those services. These caps actually do lower the overall price of healthcare generally. They are arguing that the government should be forced to pay whatever the heck hospitals and doctors want to charge.
That's a bad idea.
Which, for anybody who has private insurance, if you've ever seen somebody get charged $2,500 for a dollar bag of saline, you'll know how crazy that is as an idea.
Yeah. Imagine having to pay an entire year's worth of wages to have a child.
I mean, that happens to people here at present.
I know. That's...
But also, what the AI, the same kind of AI that will just, pick out African American people for no reason whatsoever, of course, as automatically being criminals. That kind of AI.
Oh yeah, because AI is completely reliable. Yeah.
The kind that's currently committing mass copyright fraud. That kind of AI.
That's wonderful. Yeah. It's not going to be an issue at all.
So the next section, they talk about a whole bunch of laws, which we will go over those in a future stream on its own when we talk about healthcare, alongside things like the abortion and the fetal lines and stuff that they want to do. They talk about regulations should advance site neutrality. This is on page 464 /496. Additionally, regulations should advance site neutrality by eliminating the inpatient-only list and expanding the ambulatory surgical center-covered procedures list.
Which means, in non-lawyer speak?
It means that they should increase the ability for people to perform surgeries outside of hospitals.
Oh, that's great.
They should also remove the inpatient lists, meaning that for those who don't know, before the ACA passed regulations, you could be in a hospital that. Oh, wait, no, the inpatient only list is a different thing. So there's basically stating that you should be allowed to get surgery and then not have any monitoring afterwards.
Ah, that's a good idea because nothing ever goes wrong after surgery.
Whether a medical service is delivered in a physician's office, a clinic, or a hospital setting, the Medicare payment for that service should be the same.
Mm.
No, it shouldn't.
Mm.
CMS should expand the application of site-neutral payment options to more settings. Such a policy would level the playing field among providers and remove the financial disabilities for medical professionals who would compete with hospital systems.
Okay. I don't understand that because I have a functioning
Rich
health
people
system.
should be allowed to have doctors go to their houses and get it paid for by the government.
Oh, okay. Okay, that's a good idea. Oh, wait. Just anyway.
Encourage more direct competition between Medicare Advantage and private plans, as though there isn't already major problems with that. So, Medicare Advantage, I'd have to go for hours to explain all of the ridiculous things that have to do with Medicare supplementary plans. But at present, the system is complicated. They want to make it more complicated.
Okay, that's a good idea because having a more complicated health system is not going to affect anyone at all. People with disabilities, poor people, people with with people like ADHD. I mean, yeah, no, those people aren't going to be affected at all.
However, I really want to direct your attention to page 465.
465, which number?
497. It's the next page. Start with legacy Medicare reform and just shout all of the bolded points, because even you, I'm pretty sure, will recognize why all of this is a bad thing.
Okay, legacy Medicare reform. Okay, instantaneously, I'm thinking this is bad. Legislation reforming legacy non-MA Medicare should base payments on the health system. Base payments on. Excuse me while I try and learn how to read. Base payments on the health status of the patient or intensity of the service rather than where the patient happens to receive that service.
On the health status of the patient. Oh, well, we don't have to pay as much if you had a heart attack or you've got diabetes.
Replace the bureaucrat-driven fee-for-service system with value-based payments to empower patients to find the care that best serves their needs.
Translating that to English, we should make the government pay and whatever the heck people want to charge and bankrupt Medicare.
Codify price transparency regulations.
I mean, the problem is what exactly, how would those work?
Restructure 340B drug subsidies, 27, towards beneficiaries rather than hospitals. I don't know what that means.
So basically, the drug subsidies program, instead of just giving them to, instead of paying the hospital for the subsidies, just give that money to people as
Okay.
a small grant, and that's what you get.
Is that a bad thing?
Well, again, currently the subsidies program helps pay for the medication partially. This would just give you a check and then whatever the hospital charges.
Ah, okay. So kind of bad. I'm not sure if that's a bad thing or a good thing.
Okay, so I'll put it to you this way. Currently, if a medication costs $500 and the government pays $450, you pay $50 out of pocket. In this case, the government could just give you a check for $300. The medication still costs $500.
Right.
Okay.
Now I understand. Okay. Repeal harmful health policies enacted under the Obama and Biden administrations, such as the Medicare shared savings programs and Inflation Reduction Act.
Yeah, the Inflation Reduction Act is the subject of its own stream.
And for people who don't quite understand, because I'm sure I kind of understand, but maybe not particularly well, because again, I have a functioning health system. Sorry, I keep saying that, and it feels like I'm rubbing it in. It's just sort of like, yeah, for your international viewers, what does that mean?
Okay, so I'm pulling up the shared savings program, like the Medicare shared savings program. There are groups of doctors, hospitals, and other healthcare providers who collaborate and give coordinated care to people with Medicare.
Yeah.
Basically.
So, yeah.
It saves Medicare billions of dollars.
Mm.
And it also basically, like, it saves Medicare a whole bunch of money because they do this at like a set price. And they
Yeah.
have doctors all over the country that agree to this. And they get
Okay.
tax incentives for doing it. So basically,
Okay.
they want to get rid of the cheaper doctors that have agreed to be paid less by Medicare so that seniors can actually get health care. Because remember, Medicare typically is disabled people and old people. Medicaid typically is poor people. And we're
Okay.
about to get to Medicaid.
Right. Okay. And so Medicare, so they want to get rid of something that's saving people the country billions of dollars.
Yeah, they also, for Part D, which is like your drugs, prescription drugs part, they want to get rid of the price caps on drugs that Medicare currently enforces, which again, I'm going to remind the class, Medicare and Medicaid are the biggest healthcare programs in the country. So these price drug caps actually like help reduce the cost of drugs for everybody else. So that's that section. On to the next page.
So the
Medicaid.
Medicaid. Okay. Medicaid. Over
So
the past
move it down to reform financing and the other stuff because they have all of these arguments that are meant to trigger you.
Okay. So skipping the triggering parts. Okay.
Yes.
Reform financing. Allow states to have a more flexible, accountable, predictable, transparent, and efficient financing mechanism to deliver medical services. This system should include a more balanced or blended match rate, block grants, aggregate caps, or per capita caps. Any financial system should be designed to encourage and incentivize innovation and the efficient delivery of healthcare services. Federal and state financial participation in the Medicaid program should be rational, predictable, and reasonable. It should also incentivize states to save money, improve the quality of healthcare.
Like translation, incentivizing states to save money typically means kicking people off of Medicaid.
Yeah. Direct dollars to beneficiaries more effectively and responsibly. The current funding structure for the Medicaid program rewards expansions, lacks transparency, and promotes financing gimmicks. CMS should 1. End state financing loopholes. 2. Reform payments to hospitals for uncompensated care. 3. Replace the enhanced match rate with a fairer and more rational match rate. And 4. Restructure basic financing and put the program on a more fiscally predictable budget, which should include reform of disproportionate share hospital payments to hospitals. Anything you want to mention? Because I don't understand a single thing.
So disproportionate share payments basically means that there are extra payments that are given out to hospitals that have a larger Medicare Medicaid burden. That means they take more poor patients.
Okay. And
so they want to end that. Also, fiscally predictable budget. So let me get this straight. They want to limit the amount of money that the program can spend while also allowing hospitals to charge whatever the fark they want.
Fuck. Jesus.
So on top of that, In the incentivize personal responsibility and add work requirements.
Yep.
Add work requirements and match Medicaid benefits to beneficiary needs. This is on 468/500. Clarify that states have the ability to adopt work incentives for able-bodied individuals, similar to what's required in other welfare programs, and the ability to broaden the application of targeted premiums and cost sharings to higher income enrollees. Add targeted time limits or lifetime caps to benefits to disincentivize permanent dependence. Now, remember when I said that some people who have disabilities end up on Medicaid?
Yeah. Apparently you can recover from a permanent disability, according to these people.
Also, here's another one. Allow private health insurance. Congress should allow the states the option of contributing to a private insurance benefit for all members of the family in a flexible account that rewards healthy behaviors.
Yeah, how are you going to have healthy behaviors when you're absolutely crippled by poverty, which we will get into very, very shortly.
This reform should also allow catastrophic coverage combined with an account similar to a health savings account for the direct purchase of healthcare and payment of cost sharing for most of the population. HSAs, for those of you who don't know, are basically savings accounts, which, remember that something like 60% of the American population doesn't have any money to put into any savings account, let alone one of these. Basically, it's a pre-tax savings account that you can use to cover healthcare.
All right. Increase flexible benefit redesign without waivers. CMS should add flexibility to eliminate obsolete mandatory and optional benefit requirements, and for able-bodied recipients, eliminate benefits mandates that exceed those in the private market. This should include flexibility to redesign eligibility, financing, and service delivery of long-term care to serve the most vulnerable and truly needy. Oh yeah, as if you fucking care about those people. And eliminate middle income to upper income Medicaid recipients. Why don't you just put everyone on Medicaid?
No, it says eliminate middle to upper income Medicaid recipients. So if you are lower middle class, nobody gets Medicaid.
Yeah.
Remember that the federal poverty line is way, way below the poverty line in most states.
Yeah. But I'm just saying, wild idea. Why don't you just put everyone on Medicaid regardless of their income? Wild, I know. Wild idea.
So that's what we're going to cover for now on healthcare. We need to go now to the Department of Labor stuff because we promised that we'd get to some of that within the first hour, and I made a promise in the title. So we need to put our money where our mouth is, as it were. And again, if you guys are thinking about doing super chats, if you're not in a bad financial position, these streams are very likely to get false reported and demonetized. If you're going to consider doing a super chat, now would be a wonderful time to do it because these streams are basically their kryptonite to YouTube.
Yeah. So what page number are we on?
Okay, so we're going to skip the critical race theory training and wanting to get rid of diversity, equity, and inclusion stuff. Again, because we're going to cover it in its own stream. There's a whole bunch of different aspects to how they're going to be impacting that, and I want it to have its own full discussion.
Yeah. So please remember, this is probably going to be a series of about 6 to probably 95,000 streams because there's so much we can go through on this. So if you do read this and you think to yourself, geez, we really need to talk about that, just contact myself or Ali and we can have a chat about it together. So don't, if you read through it and just go, oh, that's horrifying, let us know. And please read this document.
So we're going to jump down to 589 to the bottom where they talk about teleworking, because this is the first place where they say that they want to take away overtime pay for a certain segment of the population, but it gets worse.
Okay, 589 is... and
589 is what it says at the bottom. 621 is the PDF page.
Okay. All right. So, do you want me to start with Sabbath rest?
We talked a little bit about Sabbath rest before, but I think So basically, what they want is to incentivize time and a half as a requirement on specifically the Sabbath, whether that's Saturday for like other Judeo Christian religions, for like there are some denominations of Christianity that practice that. There's also, of course, Jewish folks, or whether that's Sunday. But
Yeah.
they want to force employers to require to prove that Saturday is their Sabbath.
Yeah. So I do actually want to. Do you mind if I just touch on this quickly? So I'll read this bit because I know you want to go.
JACandQuill, if you check the description, there is a link to this document. It is the Mandate for Leadership, which is a document published by the Heritage Institute. This is a roadmap for the president, if it's a Republican, to basically take complete control of the various executive departments within the government, like the Department of Labor, the National Institute of Health and Human Services, et cetera, and basically take direct political control with political appointees rather than protected employees who actually, have the best interest of the programs and such at heart. Yep. It is effectively a roadmap to dictatorial control over the executive branch.
Yep. Also, thank you to Ikeda for $5 for the GOP wants to put their mouth where your money is. That is true. And HU for £10. Hope this helps. Thank you very much, Lee.
Thank you very much.
Yeah. So can I talk about the Sabbath rest? Because I want to talk about, So Sabbath rest, and remember, this has got a lot of deliberately triggering things, especially for both of us, I being an atheist and Ali
me being a pagan.
And so God ordained the Sabbath as a day of rest, and until very recently, the Judeo-Christian, because that's not a dog whistle, tradition sought to honor that mandate by
the tradition, as though that's not an entire collection umbrella term of tons of stuff that like Jewish folks often object to hearing.
Yeah. That's quite anti-Semitic as well as anti-Muslim, isn't it?
Hey, so for those of you who are mad at me for covering politics, remember when I told you that I do allyship work? Yeah, Christians should be concerned about a lot of these policies for many, many reasons if they have any progressive leanings whatsoever. However, atheists and pagans, we should be real worried.
Yeah. I think anybody, regardless of your religion, because why don't you just replace, until very recently, the Muslim tradition or the pagan tradition or filthy atheist tradition? Like if you're Christian, this is horrifying. This is why being secular is the best, because secular is the default.
And then the answer to that question, Ikeda, is yes. Ikeda says, which is worse, Judeo-Christian or Greco-Roman? The answer is yes.
Yes.
So let's before you get into the Sabbath thing, though, you should probably read the little section where it talks about exemptions, because that's some BS.
Yeah. Is that above or below? Or is it
it's at the end of that paragraph.
Okay, yeah. So until very recently, the Judeo-Christian tradition sought to honor that mandate by moral and legal regulation of work on that day. Moreover, a shared day off makes it possible for families and communities to enjoy time off together rather than as atomized individuals, and provides a healthier cadence of life for everyone. Unfortunately, that communal day of rest has eroded under the pressures of consumerism and secularism, especially for low-income workers. Secularism? No, so get rid of consumerism and secularism. Just replace it with capitalism.
To be honest, consumerism, it's actually accurate. Secularism less so, but consumerism is actually accurate. Consumerism has very much pushed this. Back in the 50s, the bad old days, there were a lot of businesses that were closed on the weekends.
Yeah, and in a way, I think that's great. I work in disabilities. I have a 24/7 job if I wanted one. So my industry is 24/7. And I do miss having time off every Saturday or Sunday, because it's the best paying day of the week, because I get paid time and a quarter on Saturday and time and a half on Sunday. Frankly, I think it should be time and a half and time and 3/4, but that's just me. So in my experience, but But yeah, a shared day off makes it possible for families and communities to enjoy their time off together. And it is sad because we are fracturing as a society, because it is now 24, like society is now 24/7.
You've reread that
Yeah,
section. So we
I
should
know.
probably
I'm
get to
just
the
yeah,
bold part.
yeah. But that's just my input, that I do actually miss the fact that we don't have that as much as we used to. Congress should encourage communal rest by amending the Fair Labor Standards Act of FLSA, FLSA, to require that workers be paid time and a half for hours worked on the Sabbath. That day would default to a Sunday, except for employers with a sincere religious observance of a Sabbath at a different time, e.g., Friday sundown on to Saturday sundown. The obligation would transfer to that period instead. Houses of worship, to the limited extent that they may have FLSA covered employees, and employers legally required to operate around the clock, such as hospitals and first responders, would be exempt, as would workers otherwise exempt from overtime. So I wouldn't get that if they wanted to talk about that. So I had someone say to me once that they had a person, like, she worked in a hospital, and she had one of her co-workers that took their weekends on a Wednesday and Thursday because they got more money on a Saturday or a Sunday. She goes, "Why should these people get paid more on Saturday or Sunday? The world's like the world doesn't have a Saturday or Sunday off." That's not true. There are a lot of people who work Monday to Friday, and I
In
have
fact,
had
most white collar jobs are Monday to Friday.
And I have had multiple times where people have said to me, "Oh, it's Saturday night. I'm going out to it's my birthday. Do you want to come out for my birthday?" And I'm like, "No, I'm working." My
Yes, Vincent DeLion, to answer that question, are they saying the religious day off would depend on your employer? That is correct. If a Jewish person owned it, then it owns the company, then you would get Friday to Saturday off.
Yeah. And if yeah. So, you'd get it off or paid more.
Yeah.
Yeah. So, but that's the thing. It's like employees legally required to operate around the clock would be exempt, as would workers otherwise exempt from overtime. That's like completely unfair, because the reason why you get paid extra is because you're compensated for the fact that you're working bad hours, like what they call antisocial hours. So I've had multiple times when people have gone, "It's my birthday, I'm partying on Saturday night. Do you want to come over?" And I've had to say no because I'm working. Like, I've missed out on a lot of things. Can come over. It's my birthday party on Sunday. I can't. I'm working. And the only reason why I said yes to that is because I got paid a lot more money. So even though somebody who works Wednesday and Thursday as their weekend yeah, of course they should bloody get paid more, because everyone else has their weekend on a Saturday and Sunday, and you're working those times. You've had to say no. That's your compensation. So I don't know if you feel any different, Ali.
Nope. Nope.
Nope. All right. Okay. Do you want me to read alternative view?
No, I think we pretty much covered it.
Mm-hmm.
So now teleworking. So this is the first stage of them wanting to get rid of overtime pay. They start by targeting if you work from home.
Yeah. Teleworking. Teleworking. COVID made telework ubiquitous, but the law and regulations are stuck in an era where telework was unique. True. Congress should clarify that overtime for telework applies only if, and we talked about this quite a bit over the past couple of days, if the employee exceeds 10 hours of work in a specific day and the total hours for the week exceed 40. Meaning, Ali,
You could potentially work 7 days a week, 10 hours a day, 70 hours. But because you worked 10 hours a day, no OT.
not a bit. So, yeah. So that means that it's quite ripe for abuse. Having a person work 9 hours and 45 minutes, 5 days a week and get paid exactly the same as they would have if they had got, if they didn't work those, if they worked an extra 45. Oh no, wait, hang on. What did you say?
That would be an extra 30 hours.
Yeah.
So that would be an extra 30 hours, and you'd get no time and a half for that extra 30 hours.
But the thing is, you could go 10 and a half hours, 11 hours, blah, blah, blah. But all you need is 1 day of that week to be under 10 hours, and you don't get paid any overtime. One singular day.
Well, no, it's actually not. It's even worse than that. You have to work over 10 hours, and only the day you work over 10 hours do you get time and a half for, no matter how many hours you work in a week.
Yeah. So
this is, in fact, why we need unions, JACada. Yes. So let's keep going, because this is even worse.
Okay. This entire next bit is bolded. I'm not going to yell at everybody. DOL should clarify that an employee given the option to telework need only record time if the quantity of work assigned for that day exceeds the usual amount of work that employee performs, so that the employee need not track every time he, not they, he or she logs in and out, and the employee need not do so either.
We should incentivize wage theft specifically for work telehealth, like for telecommuting work.
Yeah.
That's literally what that is.
Yeah. So need only record time if the quantity of work assigned for that day exceeds the usual amount of work the employee performs.
So that's even worse. So that's even less ability to get overtime pay.
Yeah. So they don't even have, they're not required to log in or log out they're not required.
So basically they could just pay you for 8 hours of work, even if you worked for 12.
Yep. And this is all bolded again, so I don't want to yell at you all. DOL should clarify that a home office is not subject to OSHA regulations, and that time to set up a home office is not compensable time or eligible for overtime calculations. DOL
so even if your employer requires very specific things for your home office in order to make sure that you're actually working, etc., you don't get paid for the time to set that up, even if your employer has requirements on how it has to work.
Yeah. And also it means that if, let's say, you're behind a screen all day, but they don't have to give you not a good chair, good desk or anything like that. So you might be sitting hunched over a crappy laptop, and so you end up injuring yourself because you don't have a good desk or whatever. Because it's not OSHA, they're not subject to OSHA regulations. So that means that that workplace health and safety does not apply, and you can get injured sitting at your with a laptop. You can get injured just not moving. I know, because I was suffering from a severe back spasm last week because I was hunched over for about 3 or 4 hours. So anyway, so you can't complain to your employer that you haven't got OSHA, you haven't been injured. You can't complain, and they don't have to supply you with good quality office shit, which you should be given. And DOL should likewise clarify that reimbursement for home office expenses is not part of the employee's regular rate, even if those reimbursements are repetitive, such as for internet or phone call services. So you have to pay.
I mean, that's actually no, they're saying reimbursement isn't just part of your regular pay rate.
Oh, okay.
Which is, that part is technically kind of fine. However, I would like to skip down to 592/624, because this is where we cash in on the promise of the stream title.
So do you want me to read the bolded sections?
Well, actually, I want you to start at the very top of the page, because I want you all to hear their arguments for this.
Okay. I'm not going to do that in a racist Italian accent. It's italicized, which is why I was thinking I was going Italian, but I won't. So the next 3 words are italicized. Overtime pay threshold. All right, let's get into it. Overtime pay is one of the most challenging aspects of the Fair Labor Standard Act rules. I'm going to go FLSA because that's easier to say. Non-exempt workers, e.g., workers whose jobs duties fall within the law's power or whose total pay is low enough, must be paid overtime, 150% of the regular rate, for every hour over 40 in a work week. Do you want me to? Are you happy for
Keep
me?
going.
Do you want to say? Keep going. All right.
Because that is, in
Overtime.
fact, how overtime works. For anybody who makes an hourly rate, that's pretty much how it works.
Yep. Overtime requirements may discourage employers from offering certain fringe benefits such as reimbursement for education, childcare, or even free meals because the benefits value may be included in the regular rate that must be paid at 150% of for all overtime hours. And because some of these fringe benefits may be more valuable and often come with tax preferences that benefit the worker, the goal should be to set a threshold to ensure lower income workers have the protections of overtime pay without discouraging employers from offering these benefits.
So that sounds like they're trying to protect your overtime pay, right? But let's keep going.
Sounds pretty good. Sounds pretty good so far. So far. Okay. DOL should maintain an overtime threshold that does not punish businesses in low-cost regions, e.g. the Southeast United States. The Trump era threshold is high enough to capture most line workers in lower cost regions. One possibility to consider, likely requiring congressional action, would be to automatically update the thresholds every 5 years using the Personal Consumption Expenditures, or PCE, as an inflation adjustment. This could reduce the likelihood of a future administration attempting to make significant changes, but would also impose more adjustments on businesses as those automatic increases take hold. I don't understand what that means.
So basically, what they're stating is that in lower cost regions, effectively, they should be allowed to increase the number of hours it takes to accumulate overtime.
Oh, yeah, that's good. Didn't they do studies and found that people who work 40 hours a week are less productive people? Like they work more than 40 hours a week, they're less productive and
Yep.
actually saves and companies save money if they if they hire a new person. So a
Yeah, if
person
they
is
pay, like, if you get paid for 40 hours a week and you only like work 30, it actually increases your productivity.
yeah. Yeah.
However, the key is that you have to get paid more.
Yeah.
So the thing that I want to really draw your attention to, because the second point sounds great. Oh, well, benefits provided shouldn't be part of overtime pay calculations.
Mm. All right.
Mm.
Do you want me to
Congress
I'll
should
read it.
provide flexibilities to employees. Go ahead and read that section, because that's
Okay.
part of where they're trying to start taking away your overtime pay.
Congress should provide flexibility to employers and employees to calculate the overtime period over a longer number of weeks. Specifically, employers and employees should be able to set a 2 or 4 week period over which to calculate overtime. This would give workers greater flexibility to work more hours in one week and fewer hours in the next, and would not require the employer to pay them more for that same total of hours of work during the entire period. Oh, I've been stung by something similar to this, to be honest with you.
So if you worked 50 hours one week and 30 hours the next, they wouldn't have to pay you overtime for having to work those extra 10 hours the first week.
Yep. Yep. I've actually been stung by that. I worked something like, 40 or 50 or 60 hours one week, and then they wouldn't give me any work the next week. That was a really shitty work. Yeah, they were a really shitty employer.
So then they talk about, okay, so labor agencies to provide compliance assistance to help businesses and workers better understand the agency's position on their rules. That's fine. Clear and restrictive rules on guidance documents.
All right, let's get into that.
I would like to, most of this stuff, the justifications, we don't have to get too deep into. I would like to scroll to the next page and start looking at the bolded sections.
Okay. All right. The
On the
next couple of points are bolded. I'm not going to yell at you. The Labor Agency should exercise their available discretion and duties under the Regulatory Flexibility Act to exempt small entities from regulations where possible. So does that
So
mean
small
that
businesses don't have to follow the law.
Yeah, that's basically it. Congress should enact legislation increasing the revenue thresholds at which the National Labor Relations Board asserts jurisdiction over employers to match changes in inflation that have occurred since 1935 and better reflect the definition of small business used by the federal government.
That's pretty self-explanatory.
Okay. And Congress and DOL, in enforcement discretion, should exempt small businesses, first-time, non-willful violators from fines issued by the OH and Occupational Health and Safety Administration.
So yeah, small businesses should be exempted from fines if they didn't know better.
Yeah, but yes, that's bullshit. I'm sorry. It doesn't matter how small you are. If you're breaking OH&S regulations, you should be fined. There was a very sad story happened the other day on my city, where a 17-year-old was not supplied with. They told him that they weren't going to supply him with PPE, so he had to go out and buy his own PPE. And he bought a hard hat, but it didn't have a strap underneath to hold it down, and he fell down an unmarked manhole, and he died. Doesn't matter how small of a company you are, you need to supply PPE because people die if you don't do that.
Also, the next section.
Mhm.
So the next section basically talks about how they should take the money that is currently going into supplementing college programs and redirect it to even give employers subsidies for on-the-job training for new hires.
Okay. So is that the education vocational training one?
Yeah.
Do you want me to read that whole section?
I think we can pretty much just cover it with that summation. That's pretty much what all that legalese adds up to. And
Okay.
then the federal BA box. So we talked pretty much at length about this. I'm not sure if we need to cover it as in depth, but effectively, they want to exempt the government from requiring Bachelor of Arts degrees, which include things like psychology, sometimes, by the way, or, teaching.
Librarians.
And prohibit legally the use of BA requirements in job descriptions, including for the private sector.
Yeah. So you know how they're always going after those liberal arts degrees? If you actually look up what a liberal art degree gives you, there's some very foundational to society jobs that are given to you if you have a liberal arts degree. It's not just someone walking around and, like doing interpretive dance. It's not just that.
It's
There
not
are
just art. It's not
yeah,
just art and like graphic design. It's certain psychology degrees. It's teaching degrees. It's degrees in things like English. It's archaeology.
it's
It's anthropology. It's
anthrop
many of the social sciences.
Yep. There's like some of the things, like even
Business degrees.
business degrees, economics was a part of the liberal arts, didn't you say when we looked this up
Yep, you can either
yesterday?
pick a BA or a BS in economics.
There's graphic design. I mean, how important is that in our country, in our society? Like, just think for how often you walk around, you see something that was done by a graphic designer. Like, um, even like every thumbnail that you see on YouTube is graphic design. And some people have some really impressive graphic designs. Other people, like myself, it's you look at it and your eyes start bleeding. So graphics design is very important. And to say that you know that graphic design is my passion joke, yeah, that's the that's what they're saying that you don't need. So
Yeah, even for like, caseworkers, for example, which currently requires you to get a degree specifically in that. Nah, any Joe off the street could get hired if if they talk real well. That's
yep.
that's not a good thing.
No. So liberal arts degrees, really important. Really, really important.
So federal workforce development programs, outcome-based metrics, which is another great way of saying, like, let's shut them down. Federal unemployment insurance program, page 598/630. Let's go down to the bolded section.
Okay. All right. This next bit's completely bolded, so I'm not going to yell at you. Congress should enact bipartisan common sense UI programs reforms, including statutory authority for the Labor Office of Inspector Generals, or OIG, to access all state UI records for the purposes of investigation and requiring state agencies to cross-match applicants with the National Directory of New Hires.
So yeah, if you get hired, you get your unemployment benefits cut off literally right then and there, instead of getting it, for another week or two afterwards to help support you.
So if it's a company that
Even if
pays
you haven't
monthly,
started yet.
Yeah. Oh, so if you get paid, can you start in a month's time? You lose your money.
Yep.
Or if a company pays monthly and they hire you halfway through or just after they've paid, you don't get money for another month. You've got nothing for another month.
Congress should provide the Department of Licensing with more reasonable enforcement tools for the UI system.
So currently, DOL can either send a strongly worded letter or revoke the entire federal unemployment tax, FUTA, tax credit, which would place an immediate 6 to 7% tax on all covered employers. I don't understand.
Oh, boo-hoo. Big companies have to pay a little more.
Oh, poor things.
DOL should review all actual or planned procurements against the $2 billion for UI fraud detection, accessibility, and equity investments.
These funds do not have appropriation timelines and have very minimal statutory descriptions of the intended purpose. DOL should also review and propose changes to improve state monitoring programs, including developing evidence-based framework for evaluating the technical readiness and security postures of the state agencies, strengthen its relationship with the OIG and Government Accountability Office, and support continued development of fraud prosecution with the DOJ, the Department of Homeland Security, and the financial services community, ensure administrative and IT funding is outcome-based, and gather and publish best practices from state officials, industry partners, and other vendors who deliver UI services.
Basically, let's make it easier to take people to court for alleged fraud.
Can I tell you about something that happened in Australia not that long ago?
Well, we've only got 45 minutes left, and we still have a lot of stuff to cover. We haven't gotten to the union stuff.
Yeah, this is actually really important. Like, this is very, very related to this.
Okay.
So what happened in 2016, 17 or something like that, the Morrison government decided to put out something called robo-debt. And so basically what it did was if you were working, if you were receiving Centrelink benefits, the robo-debt will come along and they would just go through and find if you owed the money to Centrelink, which was bullshit, because it really affected people who are casual workers but still on unemployment benefits. So let's say if I worked 18 hours one fortnight, one week, one fortnight, and then the next a different week in the fortnight, then it would calculate rather than doing it fortnightly by fortnightly. So you could have worked 18 hours at the beginning of your employment, and by the end of it, you would have been working, full time, and you weren't actually on robo-debt. What they would do was they would take those hours and average it across the year, and so it would pick up that you actually were working more. You shouldn't have been paid even by Centrelink at the beginning of the year, because it's saying, oh no, you earned this much money and we still paid you. And it ended up, I think something like thousands of people killed themselves over this, because there were people who were very sick, and they ended up killing themselves because it made it easier, and they retroactively applied it 6 or 7 years in the past. and said, "Oh, you owe us money." And so here's these people who were literally were like, "I can't pay you back this money." And also Australians' unemployment benefits are like the second lowest in the OECD. Like our unemployment benefits are bullshit low. And like it's 60% of the poverty line. And so what they're doing here will kill people. If you're going to go by Australia, it will kill people. And it was actually found to be illegal. Like they took it to the Supreme Court, and the Supreme Court said this killed people and it was illegal. So if you're going to make it easier to sue people for getting unemployment benefits, people will die. People will die, and I'm not saying that as a oh, scary. No, people will actually die if you ever look at the Robodebt scandal that happened in Australia.
So I'm going to have to, because we're getting low on time, I'm going to have to summarize a lot of the stuff for the unions. So there are two big points in the union section that I want to highlight. One of them is that the Republicans want to replace unionizing with a non-voting, voluntary member elected by employees to the boards of corporations that has no power but can verbally make suggestions in meetings.
That's going to be useful.
So that is one of them. The other is that they want employers to be able to do secret ballots for unionization instead of the current open signed card system.
Yeah.
Yeah, because that's not going to, go wrong at all.
No, because that's not going to make employers just go, oh, 75% of these people want to unionize. Oh, well, we'll just get rid of 30% of those yes votes, and then we'll just make out that they didn't want to unionize.
Also, they want to make it so that the federal government doesn't have to take union contractors anymore.
Okay, cool.
They also want to make it so that union contracts with, say, big labor groups like, say, construction unions no longer require all construction to be within union boundaries.
Oh, okay. So people are going to die on that, are they?
So then we have even more.
What?
Page 605
Okay.
/637. There's a section that's bolded called labor law.
Labor law.
Go ahead and just read that whole section, including the dot point there, and then I'm going to pause and let the chat think about it for a second, and then we're going to cover what this means, because this is the part that I was talking to you about, where I was like, they want to get rid of OSHA, they want to get rid of. Just go ahead and listen to what they're going to say here.
Labor law. The federal laws governing labor management relations have barely changed in generations, and reforms on the federal level have been almost impossible to get through Congress. To modernize labor laws, Congress should pass legislation allowing waivers for states and local governments.
Just pause there for a second.
I'll read that again.
Go ahead and repeat it again.
Pass legislation allowing waivers for states and local governments
from labor laws.
Yeah.
All labor laws.
So fun. Wasn't it in Texas?
That's labor regulations, that's unemployment, that's overtime, that is workplace protections based off of, race and gender and sex and, religious. That's all labor laws.
Yeah.
Go ahead and read the rest of it.
To encourage experimentation and reform efforts at the state and local levels, Congress should pass legislation allowing waivers from federal labor laws like the NLRA and FSLA under certain conditions. State and local governments seeking waivers would be required to demonstrate that reforms would accomplish the purpose of the underlying law and not take away any current rights held by workers or employers. In addition, waivers would be limited to a 5-year period, after which time they could be modified, cancelled, or renewed. So the question is, if passed legislation allowing waivers for states and local governments for all labor laws, does that mean that, technically speaking, they can get rid of minimum wage?
Correct. That would be a labor law.
That would be a labor law.
So
there
when
isn't-
I put that title, I meant it. They want to get rid of your overtime pay. They want to get rid of your minimum wage. They want to get rid of programs that ensure that if you're unemployed, you're taken care of. They want to get rid of things like COBRA that ensure that you can continue your, even if it's like ridiculous prices, that allow you to continue your health insurance. They want to get rid of the OSHA regulations that stop you from getting your arm cut off by some wayward machine.
Yep. America, this is, and call me hyperbolic. This is them actively trying to bring slavery back into America.
Or the minimum serfdom.
Mm-hmm. If you can't,
that also means the restrictions on things like company housing, or you can't pay in scrip. If you guys remember that whole thing about like the company towns thing, there are laws that prevent that right now. Exemption from all labor laws.
Yep. Indentured servitude. That sort of shit. You know. That's literally, you're going to have people, they're just literally trying to bring back slavery into America.
All right, let's keep going because it gets worse. We've got two ICADA chats. We need a nationwide general strike until we get an actual left-wing party, and another $5 super chat. It's like Jim Crow, but for everyone.
Hooray! At least that's, at least it's going to be non-racist. Okay. Excessive occupational regulation. Sorry, I should have yelled at you about that one. Excessive occupational regulation. Excessive occupational regulation, most typically encountered as occupational licensing, creates underemployment and wasted resources and artificially increases consumer prices. It is a significant problem that is difficult to address at the federal level. Though every occupational regulation was brought in by blood.
Every OSHA regulation is written in blood. As annoying as some of them can be, and trust me, they are. As annoying as some of them can be, they're there for a reason.
Yep.
But keep going. It's worse.
Congress should ensure that interstate compacts for occupational license recognition that are federally funded do not require new or additional qualifications, that is, qualifications that do not originate from state governments themselves, for licensed professionals to participate.
That means that if the state government, like if the federal government can't make licensing laws, that's basically what that means.
Yep. So basically it means that your doctor doesn't have to go to medical school.
It gets even worse. Because the next one actually uses medical doctors as an example. And you actually are enough within this, but I am too, from my original major, even though I didn't complete it, to talk about why residency is a necessity. So go ahead and read this next section, because they actually use medical residency, removing medical residency as an example.
Congress should ensure that well-qualified licensees are not locked out of the job market by restrictive government programs funded by the federal government. For instance, medical doctors must complete residency training to practice, and because Medicare provides funding for significantly fewer residencies than there are doctors, sizable numbers of MDs are locked out of the job market every year. Well, then just increase residency training. Increase the Medicare funding, you dongs. I don't know why it's silly moves. Yeah. So
they want to remove things like residency, which, by the way, part of the reason they require residency is so that you can actually get on the job training dealing with patients under supervision. So you don't get doctors doing things like, just telling a woman to lose weight instead of actually taking into account that, like, she's bleeding out of her right kidney.
Yeah. Yeah. There's I just want to clarify something. I realized that I might have said something that sounded slightly racist. I meant ding dongs, not the other word, because I recognize that that is a very racist term, and I did not say that. I'm trying hard not to swear, even though I am an Australian. I'm trying to keep this fairly. So I just wanted to clarify that I was not saying a racist term.
All right, so now I would like you to scroll all the way down to 611/643. Putting American workers first.
Oh, yeah, that's going to happen. A labor agenda focused on the strength of American families must put American workers first, says the people who are talking about removing all legislations for protecting American workers. Cool. As the family necessarily puts the interests of its members first, so too the United States must put the interests of American workers first. Okay. Speaking of me not being racist, let's talk about them being racist. Immigration. The H-2A visa, meant to allow temporary agricultural workers into the US, also suffers frequent employer abuse. The low cost of H-2A workers undercuts American workers in agricultural employment. The H-2A program is not subject to any statutory numerical cap and has been expanding in recent years, surpassing 200,000 visa issuances for the first time in 2019. Cap and phase down the H-2A visa program. Congress should immediately cap this program at its current levels and establish a schedule for its gradual and predictable phase down over the subsequent 10 to 20 years, reducing the necessary incentives for the industry to invest in raising productivity, including through capital
which,
investment.
by the way, is translated to forcing these workers to work even longer hours.
Yep. Including through capital investment in the agricultural equipment and increasing employment for Americans in the agricultural sector. Didn't they get rid of, didn't they ban, non-Americans from
They did that
harvesting
during the Trump
things?
administration, and what ended up happening was they found so few workers that could fill that crops literally rotted in the fields, as Gaius just pointed out.
Yes. And I think I read somewhere that illegal immigration brings billions of dollars into the US. Like literally billions of dollars. Illegal workers brings billions of dollars worth of income into the US. Sort of, yeah, it's talking about cutting off your nose to spite your face.
So then, the rest of that is pretty much just no more immigration, no matter how skilled they are. And then we have visa fraud on page 613/645.
Yep. Whereabouts? Aha. American businesses that commit visa fraud and hire illegal immigrants should not be the beneficiaries of federal spending. But a 2020 report by the Department of Labor's Office of Inspector General, OIG, examined the department's process for excluding employers who commit visa fraud and abuse from federal contracts and found much to be desired. To protect the American workforce from unscrupulous immigration lawyers, employers, and labor brokers, the department must follow the recommendations of the OIG and institute more robust investigations for suspected visa frauds and speedier debarments for those found guilty.
I mean, that's pretty much self-explanatory.
Yep. What do you think the ramifications of this policy would be?
I mean, basically, it means that they're going to be kicking out immigrants significantly faster.
Yeah. Which, again, wasn't there a study that showed illegal immigrations brought billions of dollars into the US economy?
Yeah, it did.
yeah.
And also, literally, the US economy is currently dependent on illegal labor.
Yeah. Okay. Do you want me to continue on the international labor policy?
Well, for the most part, that's mostly just like, oh, well, get rid of slavery, which, protect
Yeah.
workers' rights to organize and participate voluntarily in a union without employer interference or discrimination, as in, like
Yeah,
the
that's not
secret
gonna.
ballots that they were talking about.
Yeah,
Rapid
yeah. Or
response mechanisms to provide an independent panel of investigation for denial of labor rights at covered facilities, except that we
yep,
just said.
yeah. I'd
Um,
like to point out that with the protect workers' rights to organise and participate voluntarily in a union without employer interference or discrimination. Does that mean that they're going to get rid of what's it called uh union busting?
No, that actually means they're promoting union busting, because
Oh,
basically
okay,
at
yes.
present, if a company has a negotiated union contract for a sector of their labor force, if you get hired to that job, you are required to join the union. They want to make it so you're not required to join the union anymore.
Yeah. So, but union busting firms they're because if you're going to
Yep,
go both
as Akeda
ways,
just said, basically this makes the whole country a right to work state.
yep.
However, organizational agendas 615/647. This sums up what this entire section, what they want.
Okay. This is all bolded, so I'm not going to yell at you. Budget. Reduce the agency's budgets to the low end of the historical average. The Trump administration's financial year 2020 request, $10.9 billion, would provide a workable target for spending reductions for the Department of Labor, for example.
So they want to starve it. So they want to starve out the agency that actually prosecutes employers for like labor law violations.
Yeah. Spending reductions should occur primarily in the Employment and Training Administration. Focus health and safety inspections on egregious offenders, as other inspections are often abused to an absurd state and local government prerogatives. My biggest question is, what is egregious offenders? What's your, like, it's such, there's no, it's just there. It's egregious. What's
So
an egregious
if
offender?
they stole 10,000 hours of overtime, is that as bad as 50,000 hours?
Yeah. Or, okay, so if somebody got fired for being pagan, for example, is that less or more or just the same as egregiously as for somebody who got fired for being Christian?
But the next point is even scarier.
Mm-hmm. Maximize hiring of political appointees. At its best, the Trump administration Department of Labor worked up with up to 150 political appointees. That is still a tiny percentage of the department. The number of political appointees should be maximized in order to improve the political accountability of the department.
So, for those of you who don't know, a political appointee in an executive branch can be fired by the president because he doesn't like the color of their eyes. They're completely dependent on the president's authority.
Yep. So they can't speak out against the president. Appoint new EEOC and NLRB general counsels on day one. The Biden administration broke significant precedent by firing the EEOC and NLRB general counsels despite their term appointments. The next administration should do the same and expand on the Biden administration's new precedent by refusing to acknowledge terms in other offices where applicable and installing acting or new full officers immediately. So,
and another one, implement a hiring freeze for career officials.
A hiring freeze imposes financial discipline on agencies' personal costs and reduces by agency bloat.
However, the other thing is, remember they said they want to increase the hiring of political appointees while freezing the career officials who are protected from firing if they displease the dictator.
There's something a little bit contradictory about that. I can't quite put my finger on it. Anyway. But also the appoint the new EEOC and NLRB general counsels on day one. I don't understand that. Like broke significant precedents by firing the EEOC.
But they
and
didn't.
NLRB.
Those people were in acting roles. They weren't actually in full terms.
Okay. All right. Yeah. There's a lot of misinformation about that in this document. There's so much misinformation in this document, huge amount of it. So if you read this and they claim something, you're going to have to look that up. So reading this might take you literally 4 or 5 months because you're going to have to look out for every claim they make. So yeah, the Office of Compliance Initiatives. Do you want me to read this bit?
Pretty much this just is saying that like they should reopen the office that helps advise like employers and employees on their rights. But then we have the OFLC, which is the Office of Foreign Labor Certification, should be moved out of the ETA and made directly accountable to the secretary with a politically accountable director. Again, another person who can be fired if the president doesn't like them.
Yep. So this is the conclusion, and I think if I read this, try not to
But
have
like
an
they have all these different like policies and they really want to screw over workers' rights, but at the end, notice that they have not one, not two, but three entire points about how they can seize even more political power over this agency. Despite the fact that they keep giving lots and lots of lip service to workers' rights and, overtime pay on the Sabbath, except that they also want to be able to put waivers out there for any state that feels like just not wanting labor laws anymore.
Yep. Yep. And also that if you work in the healthcare industry or a 24/7 industry, you don't get you don't get Sabbath pay. How is that's bullshit. That's going to encourage people to not go into, or like doctors. Oh, why would I give up my Saturday? And so if you have a heart attack on the weekend, you're fucked. Like seriously, you're fucked. I mean, you're fucked already, but like you're even more. Conclusion. So everyone, be prepared to have an aneurysm. The good of the American family is at the heart of the conservative Labor policy recommendations.
Are you sure about that?
I don't think they are. The long-standing tradition of a strong work ethic in American culture must be encouraged and strengthened by policies that promote family-sustaining jobs by getting rid of overtime pay, by eliminating the policies promoted by the DEI agenda, promoting pro-life policies that support family life, expanding available apprenticeship programs, including by encouraging the role of religious organization in apprenticeships, making family-sustaining jobs accessible, simplifying employment requirements and allowing employers to prefer American citizens when making hiring decisions, among other policy recommendations discussed above, we can begin to secure a future in which the American worker, and by extension the American family, can thrive and prosper.
Yeah, again, we ignored the section on like the abortion regulations and all that stuff. That's getting its own stream.
There was one policy that we both went, oh, that's actually pretty good, which was the
It was the section that required childcare. Like it incentivized, it gave out federal subsidies for childcare on the job, which is a good idea, actually.
Yeah, it's a good idea for all jobs, in my opinion,
And
rather than
and any gender of worker.
Yeah, and that there's obviously that little asterisk going, stating that it's not like it's not going to be all people and all jobs and stuff like that. It's just going to be certain jobs. But yeah, so so is there anything else we want to talk about?
Let's just kind of draw some conclusions on the power here. So first off, y'all, I did in fact deliver on the promise of the title of the stream. They want to not just cut your overtime pay, but every other one of your workers' rights at the discretion of any state who applies to do so in the name of quote unquote innovation and labor policy. Company towns, script, all of these innovations by companies to steal money from their workers. They want to gut the board that protects you from wage theft.
Yeah, so that's not good, because as we all know, the only reason why people get paid minimum wage is because their employer has to. So thank you, Ikeda. Heart, I hope I kept my end up. You did. Everyone thank Ikeda for being awesome. Yeah. XLR, the Night Wolf, says, "Fuck it, they just don't want to pay you for labor period." That is true. Like as I was saying, it's not a hard. I don't think this is a hyperbolic jump to say that they want to bring slavery back to America,
Or
but this
serfdom.
time, or serfdom. But this time, it's not going to be racist slavery. Well, it probably
I mean,
will be.
it probably will be.
It probably will be, yeah. But it's, everyone has an opportunity to be a slave. Hooray!
Well, and the thing is again, people don't realize that like the Republicans that they very much want to gut every right that workers have. Like that's what this document says.
Mm-hmm. Yeah. Merkel Bullworm says, "No one here has ever worked a 16-hour shift, and it shows." I'd hate to break it to you, but I actually had an experience once where
I've worked I have worked an 18-hour shift before.
I had it with one employer. In 48 hours, 40 of them were inside at work. So that's a lie. So yeah, and I also, in my industry, we have something called sleepovers. So you start work at 3 o'clock in the afternoon, and you don't go home until 10 o'clock the next morning. So yeah, I've definitely worked 16-hour shifts. Thank you very much.
As have I. I have also worked nearly 24-hour straight shifts between employers, where I worked a 12 and then jumped to a 6 and then jumped to an 8.
Yep. So, actually, the fact that we have worked these 16-hour plus shifts kind of shows you why we're pissed about this. No one should be working 16-hour shifts. Not a single person. I think 8 o'clock, like 8 to 9 hours is enough. I actually think 5-hour shifts should be the max per day, but our society is not set up for that. And we should also have 4-day weekends. The fact that productivity has gone through the roof, and yet our hours worked has gone through the roof, but our pay has stayed the same. I mean, this is worldwide. It's not just America. In Australia, it's the same things happened. Yeah. So I think this is something that we all should be talking about, it, regardless of where we live.
And I haven't actually seen any news outlets. Correct me if I'm wrong. Leave it in the comments. Let me know. Don't try to link it or it'll filter it. But like, let me know if any news outlets have actually covered this portion, because that whole state exemption to all labor laws, the ability to apply for one, is terrifying, because there are states that would absolutely do that.
Yeah. And again, Maker Bullworm says, "I start work at 4 a.m. and leave at 7 p.m. That's not good. That's not good.
And people should not be, and everybody shouldn't be held to that standard. You suffering, most people would find that as a motivation that they wouldn't want other people to suffer. Like, if you're projecting that everybody should suffer as much as you do, then at that point, you're kind of part of the problem.
Yeah.
Like, so that's a call for empathy for other people. Like, maybe other people shouldn't have to have this kind of experience, rather than everybody needs to bootstraps. Like, the whole idea of bootstraps means that you're pulling your own feet out from under you. You can't pull yourself up by your bootstraps.
Yeah. So and I know that I'm feeding the troll, but they're bringing up some really good points. You guys have no work ethic. Our grand and great grandparents worked every day for 40 hours a day for their entire lives. Again, that's
and
not
they
a good
fought
thing.
for the regulations that we're arguing that we should protect, because it killed them.
It did. Yeah, the fact that we have child labor laws is because of our grandparents and great grandparents.
They fought for us to have better lives, and we do, and that's a good thing.
Yeah, that's a good thing. So, and like as I said, I know I'm feeding
the troll, but actually, this is a good point. It is a good point. Our parents and grandparents and great grandparents fought their asses off so that we could have a better standard of living. So we shouldn't let these mofos roll the clock back, because otherwise they threw their lives and livelihoods away for nothing.
Yep. And also we aren't actually designed as a species to be working this intensely. Like, it's sort of, we can't, like, one of the things that
It
really
destroys
pisses
our
me,
bodies. Like, part of the
it
reason why we have increases in things like heart disease and diabetes is from sedentary excessive work.
Yep. And also, like, they've done studies and they've found that the average person cannot concentrate in solidly for more than like half an hour to an hour in a day, like in a row. So,
Yeah, and Jack brings up also disabled people exist. Yeah.
yep, yep. And also after COVID, like, come on, guys. COVID has caused a mass disabling event. There are so many people out there with chronic fatigue due to COVID. Um, uh, so
So yeah, I mean, nobody's saying that people shouldn't have to work at all for daily bread. We're saying that there should be common sense at this point, laws that have already been fought for, regulating and protecting workers from working themselves literally to death.
yeah. And make a bullworm again. I was taught to work like a good hard worker for my daily bread. I make 20 an hour. If you're working 16 hours a day at $20 an hour, I'm sorry, but you're destroying your life for fuck all money. And it's sort of like, like if you even take pride in yourself and if you think it's great that you work those hours, I mean, and you want to do it, go for it. But it doesn't mean that everyone else should.
I mean,
Like,
especially because that level of work literally causes heart attacks.
yeah, yeah.
So we are kind of at the tail end of the stream. We're hitting the 2 hour mark. Do we have any final non-troll feeding conclusions?
This is fucked. I don't know if you agree with me on that one, but it's just like, I don't know if I could succinctly say it any more or less.
Yeah.
Yeah. So Viva la Revolution. Everyone go out and vote.
Especially if you're in a red state. If you are in a red state, it is even more important that you actually participate in the electoral process, but also understand how things currently work. Organize protests in your area. If this ends up going through and they're starting to gut the federal government and its ability to protect you, fight. There are ways to fight this. If we understand the process of what they're doing, you can hold your own elected officials accountable. You can bomb your freaking Congress office with phone calls.
Yeah, with phone calls, everyone.
With phone calls.
With phone
like, you
calls.
can absolutely, like, take their systems offline with phone calls until they listen to you.
Yeah. Also, you can, if you want to, post them letters, only letters.
Yeah, and actually,
So,
handwritten letters are more likely to actually be looked at, more so than emails and form emails.
yep. So, you can even go and talk to them physically in person, or at least to the secretary. But be nice. The secretary does not deserve to be treated like crap. So, yeah. So I just want you all, just be nice. Remember, the people behind what you're trying to, what's happening is are people. And
And
yeah,
remember also that this document is just the start. They are providing training programs to every single one of the Republican presidential candidates and a tailored list of political appointees to put into the positions of power that they are talking about trying to take over. This is most likely our future if a Republican gets elected. And
yep,
again, this isn't us saying, oh, Democrats good, Republicans bad. This is Republicans literally want to strip every single right you have. The
yeah,
Democrats are going to do significantly less harm than that. I can almost
yeah.
guarantee it.
So yeah, because I wouldn't be surprised if a couple of Democrats actually secretly agree with this thing. So yeah, just be a little bit, just be angry, but be calm in that anger. Okay. Ikeda says, if you're making that much money, you can afford some super chat. And then for the $5 note, $5 super chat, and again for the $5 super chat. Do you hear the people sing the song of Angry Ben? This is the
Yep,
music of the people
absolutely.
who will not be slaves again when the beating of the heart echoes the beating of the drum. Something or other. I forgot the words to the song. There you go. Sorry about the ear bleeding, guys. Yeah, so we are not in 2 weeks' time. We've both agreed that we
We're
want
taking a break
from
from
this.
this.
Yes.
There is only so much my blood pressure can go up.
Yeah. And so the snake, we are going to be doing the snake thing next week, which is, oh, thank you, okay, there will be a brighter day when tomorrow comes. So if you we're going to be doing the snake thing where we talk about the evolution of why people are afraid of snakes, as well as the taught fear of snakes, and how if the more we understand and the more we learn about them, we can actually start to break this cycle of fear.
For
of
example,
snakes.
garter snakes make friends. They're actually social.
And so are rattlesnakes. Rattlesnakes make good. They avoid each other. Individuals avoid each other, and individuals also hang out with each other. I actually did an interview with Melissa Murillo, I think her name was, on my channel, Advocates for Snake Protection, and she has a PhD in rattlesnake behavior. And she's a very interesting thing. So if you hop onto my YouTube channel,
and
it was
you
a
did
really
your dissertation on snake poo.
I did my dissertation on snake poo, but snake poo is not as friendly as actual snakes.
Well, I mean, you got most of that from actual snakes.
I did actually. Well, yeah,
And
from
you
my 2
obviously
girls.
have to interact a lot with snakes in order to,
Yeah, I also have snake poo in my freezer. Just thought you'd like to know that.
So for those of you who are curious about that, we're going to be talking about both potential genetic theories for phobias versus taught cultural fear. And we're going to be talking a lot about snakes and snake behavior and some stuff you've never heard about, which will complement nicely the 3 videos I have on the snakes and Hellenism. So if you guys haven't seen those, go check those out. Also, Marrow finally put out her smallpox video. If you haven't seen that, it's been out for about 2 weeks. Go check it out.
It is down on the views. I think it's 22 views down. So if I get 20 people, I don't know how many people are in the live chat right now. Also, don't forget to like this video. But if you have not watched my smallpox video, please go and check it out, because I put so much effort. I probably put about 50 hours worth of effort into that, and YouTube demonetized it, so I've had 80 cents. 80 cents.
So go hit a like and
Yeah. So feel free to just watch it, share it with your friends, and there is some very, very, very cool animation in that as well. So, and some very bad jokes as well.
So that said, so we are going to be doing that stream not next week, but in 2 weeks. We did 2 streams back to back these last 2 weeks because I was sick for our regularly scheduled stream, so we streamed it a week later. Leave a comment, not just a chat. Leave a comment letting us know what you learned, what you are most concerned about with this, and if you have looked at the document at all, what you would like us to cover in our next stream on Project 2025. Because we will be returning to that on the stream after the next one, but we both need to breathe for a minute and not like die from heart attacks trying to go over the entirety of all the ways that this will destroy the American everything.
Yeah. So and also you can, like, if something is particularly concerning to you, obviously you open up the thing and go Control F and type in that term, because there's also other things that we want to talk about. Is sort of like how it uses language that will make people stop thinking, like as Ali said, the trigger terms that will make your head explode, and so you get angry and then you don't listen to actually read the rest of the terms.
So yes, please do leave comments. It majorly helps promote the video in the algorithm, especially because it's way likely to be demonetized. That said, though, remember, we're stronger together.
And don't forget, don't give yourself this raw porn.
See you guys in 2 weeks.
Bye.